But let me speak. Good morning. My name is Jeremy Law. I'm the senior chaplain for Greater Manchester Mental Health. We cover the whole of Greater Manchester, providing secondary and tertiary mental health services. We work for the Chaplaincy and Spiritual Care Department, so we are a mixture of imams. This is Olasheni Junaid, Christian ministers, Jewish ministers, and ministers of different faiths and religions. Today we've been greatly blessed by the Muslim Burial Trust. Is that correct?
Yeah, Project EEE is the initiative.
Project EEE has greatly blessed us with these Islamic resources. For patients who are in Greater Manchester Mental Health Services, we have a high number who are Muslim. We also have a high number of staff who are Muslim, all of whom their faith, their Islamic faith, is really important. For many of our service users, they're not easily able to access the mosque. So subsequently the imams go in and do a fantastic job in bringing religious and spiritual comfort in their struggles. These resources are so valuable to the patients in our trust, many of whom are struggling with mental ill health. And one of the things that I've learnt over many years of working with Olasheni, with working with Famid, with working in Nisa, our imams, is how within the Islamic community, and I'm sure you will vouch for this, being open and honest about mental health issues can be a bit of a struggle. Often people are either uneasy or maybe even at times ashamed or wanting to keep it hidden from either from themselves, from their families, from their communities. Part of the work that we do is to try and to be open and to be honest that mental illness is an illness. People do get ill, but also they get better. And part of the healing process often involves, for many people, prayer to God, the comfort and the support that the imams offer. Anything you want to add about that?
Firstly, Alhamdulillah Rabbil Alameen. We thank Almighty Allah for the blessings of being a Muslim. And in addition, I give a special thanks to our brothers from the Project EEE, which they've donated a lot of fantastic artifacts to this health sector. Because actually, as a Muslim chaplain and imam, sometimes we do struggle to get some artifacts for the Muslim service users. Because they might need every time Quran and some other artifacts which we can never get as our Christian counterparts used to get, because the Gideon Bibles, they used to give, I don't know, millions of Bible free to all the Christian service users. But in Islam, we've never found an organization, in my own experience, that donated as much as what the Project EEE have been donated to us today. So that is very great initiative, and we do appreciate them, and we believe that it will go a very long way to support the service user and the staff and the families and the carers. By the way, before I round up, we need to improve awareness about the mental health in the Islamic community and Muslim community, because the awareness is still not okay, to the extent that most people still hiding and they don't want to declare what they are going through in their family or in the community. So we use this opportunity to call all the Muslim brothers and families, so that whatever circumstance they might find themselves, we believe Allah is their qadar, but at the same time we need to seek for the support and the help from the pharmacologists, so that things can be going on well. Assalamu alaikum wa rahmatullahi wa barakatuh.
I really appreciate it.
Thank you very much.
Yeah. And we're doing this work in a joint effort with all communities, really, with all faiths, and
Very much so.
yeah, that needs to be clear as well. Yeah, we're working as a community and helping. Yeah,
Just
unilaterally, collaboratively.
One final pitch
Yes.
while you're still filming. We are a multi-faith and belief team, of which our Islamic brothers and sisters are an integral part in building a positive society. But we're also having an interfaith event on World Mental Health Day on the 10th of October, and I would love to extend the invitation to your organisation.
And that's on 10th of October.
10th of October, World Mental Health Day. And one of the purposes of the service is to work more collaboratively with statutory bodies such as the NHS and the social care, so that they can work with faith communities, with Islamic communities, with mosques, to help reach people who are struggling with mental illness.
And the service is at Manchester Cathedral at 6 o'clock in the evening.
Manchester Cathedral,
Yeah, and if
10th of
anybody has
October,
anything that
6 o'clock in the evening.
Yeah.
6:30.
No, 6:30.
6 or 6:30,
Yeah.
get there for 6, let's be early.
But if anybody has anything that they would like to bring and set up a stall that can help people with mental health, it might be they have a creative workshop that people come to that would that they want to promote and highlight. It might be a prayer group, it might be anything that helps towards the health and well-being of individuals. Then they're welcome to come and set up a stall. It's free of charge. They just have to get into contact with me, Giselle Rusted or Jeremy Law.
Lovely.
Yeah.
We'll get more information from you in terms
You
of a
can.
leaflet or flyer, and we'll
I'll
post
send-
it out to everyone.
I've
Yeah.
got a formal invitation I can send to your organisation.
Yeah.
It would be really good if you could make it actually,
Yeah.
and even have a stall, because I know that there are many doctors in this trust who are very devout Muslims, and they feel very strongly that greater work needs to be done between the mosques and the medical
100%.
services.
We agree. We
try and help people.
we stand with you. So
Yeah.
yeah. And if there's samosas available, we'll be there.
Well, maybe you could make
I can
them.
see if I can arrange samosas.
Why don't you make them and bring them?
Yeah.
At least
I
they-
can speak to my friend Bushra.
Yeah.
I hope and look forward to us working together more closely in the future.
Perfect. Thank you very much, guys.
That's
Thank
great.
you.